for central New Mexico. Now, we also know that these basics really matter in our community, and that's why we are prioritizing resources that ensure that seniors and kids get the meals that they need, that our first responders can be out on the front lines keeping people safe, and that our buses are running for those who need it, and that essentially the children of those putting their lives out, so healthcare workers, even our janitorial staff, our folks driving the trash trucks, their children we're trying to prioritize as well in our community centers so that they can continue to work. And so that's the way we're approaching this. We want to ask everyone to stay home if you can, right? And that's an act of solidarity to support those who either can't stay home, because staying home for a lot of us is a luxury. And for some, it's not a choice. Some folks have to work to keep our city running and keep us safe, and some folks might have to work because of income situations, single parent situations, and so forth. So we respect that, we understand that, and we're trying to do everything we can to help folks in those situations. And we're gonna have a lot of questions on this in a little bit. I also want to mention that we want people to stay home. We're using a term called social distancing, but it really is physical distancing. We want you to stay connected. Talk to your neighbors, call your family, use FaceTime if you can. Try and stay connected, email, etc., to anyone that you can. In a way, too, this is a great time for social media. While there might be a lot of myths out there and a lot of comments everywhere and so forth, it's also a great time to keep in touch with each other, sharing pictures and videos. So that's an excellent way to stay connected in this time of physical distancing. Now, I also want to note that when we say folks on the front lines, it's a wide range of people, whether it's child care workers or healthcare workers, folks who work in our grocery stores and our pharmacies, our food packers, our delivery drivers, homeless providers, bus drivers, custodial workers, senior caregivers, electricians, plumbers, interpreters. There are lots and lots of folks who are now critical, and it's important we all step up for them. Now, in Albuquerque, we're also no stranger when it comes to challenges, and I know that we're going to face this head on. I know we're going to be better when we're coming out of this, because we're going to demonstrate that one Albuquerque spirit. For us, we have always been, especially in times of need, I think a rare example of kindness and humanity towards each other. And I know I've been inspired by the daily outpouring of support that our office has received, and I know many of our city workers have received, and we are inspired to continue to fight with courage, resolve, and determination as we get through this crisis. Now, I think let's go ahead and dive into some of the questions that each of you have. And so we had hundreds come in through different platforms. So not everyone is going to get their question answered, but we're going to direct you to where you can, and we're going to take as many questions as we have in the amount of time we've got. So Alicia, what do we have first up?
Yes, absolutely. So first of all, Mayor, I just want to thank you. It's so great to be here with you today, and I just want to thank you for everything that you're doing for our city in this time of crisis. I know the community appreciates it, but I personally appreciate it as well. And so some questions from you from around the city. As you mentioned, we had a lot come in both yesterday and this morning, and so we're going to take as many as we can, and we also put some together. So if we had duplicate questions, we put them together so we could get them answered for these folks. So the first one comes from two people, from someone named Anselmo and another named Jeffrey from the Northeast Heights. And the question is, will there be a citywide shutdown like there is in New York City?
So right now, there are no plans to have a citywide shutdown. And we are preparing for that, though. And this is a very important distinction I think folks should understand. We don't want to shut down the city. We want to keep operating the way we are. We do know that now, as of the last time I checked, there are 3 states that have essentially shut down with this stay-at-home model. And so it is something we are looking at very seriously, so is the state. We know that if our hospitals become overwhelmed, that's really the key. If the medical system becomes overwhelmed, we're going to have to do that. But again, at least in the foreseeable future, which right now is like the next few days, we have no plans to do that. But I want to let folks know, as other states have and other cities, it certainly is on the table if this gets worse.
So the next question is sort of a follow-up to that question. If there is a shutdown, what type of restrictions will there be?
So I've been in touch with mayors from around the country on this, actually trying to, again, prepare. And I think we would follow a similar model to what most of the cities are now aggregating around. And it basically is about a stay-at-home model. And so it's a little different. There's a lot of vocabulary being thrown around out there. It's not quarantine. It's also not a curfew. It's just a special stay-in-home enforcement model that just says that you need to stay at home with exceptions. And that always has to do with actually even exercise. It has to do with any medical care, and it also has to do with getting supplies that you need, so grocery, shopping, things of that nature. So that model is what, if we have to do this, we would go towards. And again, I want to emphasize that's very different than other kind of disaster and outbreak scenarios. And it's one that is currently being used in 3 states and many, many cities, dozens of cities around the country. So if we have to do that, I think we have lots of good models to understand here's what works for a community and here's what doesn't.
Great. So Thomas from the West Side wants to know, if there is a shutdown, who will enforce it?
You know, I think right now, all the enforcement is being handled at the state level. So this is for restaurants and bars and so forth. And so folks right now have been very cooperative. So I'm pleased to say, and I want to thank every Burqueño for just respecting the directives and making enforcement not a big issue. In other cities, usually enforcement is dealt with things like citations and so forth, similar to parking tickets and whatnot. That's typically, I know, how a lot of towns in California are dealing with it. So we would want to keep this, you know, as light touch as possible, you know, warnings, so forth like that. You know, we do want to let folks know, though, that if there are egregious violations over and over, you know, though that's a much more serious public health concern, and that will be dealt with APD. But individuals and so forth, you know, we will respect everyone's needs and their own decision making, but we also have to enforce, in this case, what would be a temporary ordinance or law. And so we'll do that, but we'll do it with civilians, and we'll do it in a light touch way as long as we can.
So Mayor, we can tell that shutdowns are top of mind for a lot of people here in Albuquerque, and so the last question around this is, what would the plans be around non-essential businesses if a shutdown did occur?
So this is something I know our entire country is dealing with, and for us, it's all about right now encouraging folks to stay home. If things get a little bit more strict with respect to guidance, we'll be clear before there's any enforcement as to what actually is essential and non-essential. And for those who are really interested, we're keying off the federal government. FEMA has guidelines for what's essential and what's non-essential. So that would be our starting place, and then we'll modify that for our community. So if you are very curious, you can look up that's the Federal Emergency Management Administration's definitions of essential and non-essential. And I just want to note for folks that there's a lot of things that you may not think about that are essential in these times, like, for example, auto parts supplies and things like that are actually critical for all our public safety vehicles and for you to be able to get to the store. So there's actually a much wider range of businesses than a lot of people realize that actually are deemed essential.
Thank you. So this one comes from Willie. He would like to know what's being done to get information out to non-English speakers or people who don't have access to the internet.
So we're trying to do a couple of things. Number one is we have at the city identified folks who can speak at least to the mass media in Spanish. We call them our Alcalde program, which Alan Armijo, Lawrence Real, sometimes Alicia is a part of that too. So we are available certainly to folks through that. It's the same thing if you call 311. We have options. We're working on how to be able to get you to someone who speaks not just Spanish, but some of the other languages spoken here in Albuquerque. We're also trying to make sure that we're using we do have a Spanish Twitter account that we use regularly. And so we're trying to provide as much as we can in dual language or multiple options. If there is an emergency, we do now have a way to get emergency translators for dozens of languages. So folks should know that, and our first responders are trained for that. And so I think we're working that on the state level. The last thing I would say is that we have an Office of Equity and Inclusion that is heading this up. And so for more information, I would direct you to their website or just call 311 and they'll put you in touch with them. But we're actually trying to deploy a whole team around bilingual communication. And so look for that coming this week. I know they've also been having conference calls already with a lot of immigrant service providers on this issue. And so the good news is we do have a core team, and this is a good example. We view them as essential in this situation. And so they're going to continue to work to make sure that we can communicate with everyone as best that we can.
What about for internet connectivity or access issues?
So for internet connectivity and access issues, of course, we are encouraging our partners at Comcast as well as Xfinity Actually, I think that's the same company.
It is.
But the other internet providers, everyone is hopefully following this model, number one, of grace periods. And number two, at the city, we are working on ways to make our internet accessible outside city buildings. It's not up and running yet, but stay tuned. Hopefully, we're going to kind of have drive-up internet. But again, it's not ready yet, but that is one of the short-term emergency protocols we're working on starting this week.
Thank you. So this question, we had a question from various people. This one comes from Rafael, Stephanie from Northwest Hills, Daniel from Taylor Ranch, and Ani, a UNM student, and also Jacob. Will there be mortgage and rent freezes?
Yes, so what we're working on right now in the city for all city public housing, that includes 9 apartment buildings that we actually own, and the Albuquerque Housing Authority, they're also doing the same. We are holding all evictions right now for the things that we control, and we're asking others at different levels of government to do the same. I know also HUD is working on some of this at the national level too. So we're trying to do that again. The things we control, we're doing that for, and we're asking others to do the same. We also know that the Water Authority and the gas company and PNM are halting shutoffs for non-payment right now. And we are trying to also provide rental assistance. So this is something that you can call 311 about this. It's a new program, so I'm sure it's going to run out fast, but we're taking donations into that program. And we're also, again, offering it as funds roll in. So that's what we're doing at the city level. I think the only other thing I would add is, we're asking landlords. They are private individuals who are in control of that on their own. We can't force them to do anything. We're asking them to try and also follow this 30-day grace period.
Thank you. So this next question comes from Clarissa. Will the open spaces remain open?
So thanks for that question, Clarissa. One thing right now that is still permissible under all the different rules is to get outside. So while we can, take advantage of it. And the key is get outside, but just stay physically distanced. So you can go to our parks. Our crews that would normally be doing all sorts of planting and so forth are actually just sanitizing everything, even play equipment and so forth. So we're just trying to say maintain that physical distancing, but it's okay to go outside. Enjoy bike rides, enjoy walks, enjoy the parks, and open space because we have so much of it. We are the #1 city per capita for our acres of open space. So get out on the west side at the volcanoes. Get out in the Bosque in central New Mexico or central Albuquerque, and then out in the foothills on the east side. And, just wave at each other, stay 6 feet apart, and then enjoy the outdoors in New Mexico at Albuquerque.
I think this is an important question that a lot of people have on their minds, and you sort of alluded to this at the top. But this question is, can I still visit my elderly family if we go into shutdown?
So, this is one even I've been toying with. My parents live here as well as my in-laws and some other family members. And so for us, I would say this, I would not recommend you visit your family. And it is in many ways heartbreaking. Use the phone, use FaceTime. I know there's all sorts of videos on YouTube of people talking through a window, which is fine. In fact, I think next week or tomorrow on Sunday, I'm going to try and do this with my family as well. So keep in touch as best that you can, but we do know we've got to be especially careful with our elders, and we don't know if we're spreaders, right? And this is something that's going around. It's like, don't be a spreader. This is a really good example. I know families want to see each other, but you just got to think in the longer term, the joy of seeing each other and the comfort that brings will be completely offset if you're spreading this virus to your own family members. So it's very important that you try not to do that and try and find alternatives.
You mentioned the elderly are most impacted across the country by coronavirus. And so have senior centers been closed in the city?
So our senior centers and our senior affairs department is just one of the shining stars, one of the many shining stars right now in the city. And the centers themselves are closed for these reasons. But you can drive up and get meals for seniors. And we have dozens of these centers all over the city. And actually our senior center is one of our departments that actually operates countywide. So we do have locations in the South Valley and also in Tijeras. So your seniors can get meals that way. We also do home delivery. So what you can do is contact our Senior Affairs Department at 764-6400, and that is during working hours, so not this weekend. Give them a call and they will work to get you a meal delivered or tell you the best way you can pick up a meal. And we've had some amazing interaction. Seniors are writing notes, chatting in their cars, 6 feet apart in the parking lot. It's actually awesome to see.
Thank you. So this is one thing I really love about our community. It's that one Albuquerque spirit that even in these toughest times, people are still asking us this very question: how can I help?
There are lots of ways you can help. And the first thing I would suggest is take a look at our website, oneabqvolunteers.com. You can also find that through the city website. And for those of you following on social media, it might take a few minutes, but we'll post these sites in the comments section. And we're highlighting different things you can do. One is if you're in like a faith community or an organization that wants to work on food preparation, again, physically distanced appropriate, or Roadrunner Food Bank and these type of things. Right now, this is a great way to help out, and you can reach out to either your own organizations or check on that website to find out ways to help. Also, blood is very important right now. I know the First Lady was donating yesterday, and the blood banks are running low on blood. And I want to kind of explain why this is, because a lot of people are like, oh, what does that have to do with the coronavirus? Mm-hmm. Nothing directly. It has to do with the fact that the regular blood drives that always happen aren't happening now because of all the orders that are in place. So this is about us replenishing the blood supply in a new form instead of just waiting for like the blood van to come to our office. That's what this is about, but it's very important. And the way you can do it is you go to bloodhero.com. That is actually a national site that'll give you details locally. But basically, the rules are a little different for each local site, but you need to make an appointment. That's, I think, important to understand because of physical distancing. So make an appointment and give blood. That is a great thing you can do. Also, donating money to any charity that you see that you think is doing good work on this is always a good idea. You can, of course, donate to the One Albuquerque Foundation. We're going to be discussing how that's going out for housing vouchers. You can also donate to this rental assistance fund. And again, we'll post information because this is a digital town hall. We'll get it out to you digitally so you can have all the details on that, or just check out the website, oneabqvolunteers.com.
I think another important thing to highlight when you're making those donations is to make sure that the organization is verified, because this time, unfortunately, sometimes some of those scams start to come up, and we want to make sure that everyone is aware of those as well. So we have a series of healthcare questions. It's on top of mind for everyone in hospitals. And here at the Joint Information Center, we get a lot of updates from our partners in the healthcare industry. And so the first question comes from Sarah from the Northeast Heights. She wants to know how our healthcare system is doing, and is there an uptick in patients right now?
This is, of course, one of the most important questions you can ask, and we are in regular communication with the heads of our hospitals. And I'm pleased to say that, we have a responsibility and also a blessing to live in the city of Albuquerque. And this is part of it. The responsibility part is, we are where a huge portion of New Mexico gets their health care. So we have folks who are coming in here from 1,000 square miles to get health care. The upside is that we have tremendous hospitals, whether it's UNMH or Presbyterian or Loveless or even what Optum does. These programs are well-trained and well-prepared with respect to emergency preparedness. And so our hospitals right now, they're dealing with how do we keep our actual health workers in a space where they can continue to work. But that is a good thing because they do know how to expand additional beds. They do know how to deal with these kinds of scenarios. We actually trained on an anthrax scenario for all central New Mexico last year, so not that long ago. So actually systematically and from a management perspective, I actually think we're in very good shape. Now we're facing some of the same limitations as every other hospital system in the country. And actually one of them is an area where I can ask for some help. This notion of PPEs. The masks and so forth that folks need to deliver healthcare. There is a shortage right now locally for this. So if you happen to run a business, we don't need one-off donations, but if you do run a business that has a lot of chemical companies and things like this have a lot of PPEs on hand, if you have those now is the time to donate these to hospitals. So call 311 if you can do that. That is something they are in very much need of. And the other one actually is blood, so it goes right back to that previous discussion. That's what they're asking us for now. And again, as testing kits become available, through the good work at the Department of Health, again, they are working to open up more sites. So you're going to see that over time. In fact, I believe Monday we are slated to open up a new site at the Balloon Fiesta with Presbyterian. And that'll be helpful, I think, in a number of ways, especially because of efficiency. It's going to have a lot more streets for queuing and sorting. It's also going to be in a place that has a lot less impact directly on neighborhoods. And so this is one way where you're going to see, again, the hospitals are really running that process. We're just providing a resource. And so this, I think, is a situation where, relative to other places, I'm grateful for our hospital system right now.
Thank you. And as you mentioned, Presbyterian will still be doing the testing at their West Side location both today and tomorrow from 9 to 7, and then hopefully moving over to Balloon Fiesta Park on Monday. So our next question is from the West Side. When is the right time to get tested?
So the best thing you can do is ask that question to a professional, which is not necessarily me. But I will give you some guidance. But call the NM DOH hotline. That is the best thing you can do. And again, we will post that. It's everywhere, though. I think it's pretty easy to find for folks. So call them and ask. That's your first step. In general, there are some good rules of thumb. You know, we know it's allergy season. We also know people get colds and things like this. I think the real differentiator is if you're running a fever. So take your temperature often. If you're not running a fever, you know, feel free to call that line. But I wouldn't suggest getting tested at this time. We need to prioritize testing for those who are really showing symptoms. So the first gate, the first thing to think about is, do you have a fever, as well as other symptoms of the flu? And then, of course, if you've been around someone, if you've been exposed to someone who has been confirmed with coronavirus, you should go get testing. So that's kind of a big differentiator there. So if you have, you know, the sniffles, groggy throat in the morning, those kinds of things, if you're not showing any other symptoms, do not go get tested. We've got to prioritize those who are showing the symptoms with respect to coronavirus.
Thank you. So Tony wants to know, if he were to test positive, does he have to remember all of the places he had visited or been in contact with people over the last 2 weeks?
I think the most important thing there is remember what you can, and be in touch with NM DOH. That is the New Mexico Department of Health. And what they're doing with positive cases is they're going to ask you a series of questions. Just do the best that you can. And again, what they're trying to understand is, you know, again, like, is there a certain segment of folks who we should also reach out to and ask to come in and be tested and so forth. So they'll walk you through a series of questions, and just remember what you can. And again, that's all under HIPAA with respect to healthcare privacy and so forth. So I want to encourage folks to share everything they can with the DOH in that situation. And they will manage what to do next. So I think this is another good example of letting our medical and public health professionals deal with with what comes out of the answers to your questions. They will guide you, and they'll figure out who to call and that kind of thing. You don't have to worry about that on your own.
Thank you, Mayor. So the next question comes from two folks, from Catherine and Xavier. Since it's common to spread family member to family member, is there anything being set up for people to quarantine outside of their home?
So right now, because we've had such limited testing all across America, we know that you can actually have this virus and not even show any symptoms for at least up to 2 weeks. So basically the logic is that, you know, if you do come in and you're positive and you've been living with the family at home, they're already exposed. That is unfortunate for your family members, of course, but it is fortunate, and it makes your home the perfect place to stay home and be quarantined at. So it's sort of already too late to go anywhere else, so you might as well just stay at home and be with your family and take care of each other. So that's the logic for staying at home in this notion of home quarantine if you are positive. So that's actually right now the preferred public health way to deal with this. Now, I think inside some of those questions is, well, what about others and healthcare workers and so forth? We are working as a city right now to set up locations, sort of a third place. So if you don't want to go home because maybe you find out that your family members don't have it after they get tested, or for whatever medical reasons you can't do that, and then of course you can't go to work. We actually are going to be looking at methods to use our community centers and other buildings so that you'll have a safe place to be. And so again, this is actually something we've been preparing for with respect to anthrax. So our city is ready to do that should we need it. Let's hope we don't, and that the home quarantine method is much, much preferred. But know that if we do need it, actually the city is well drilled on how to provide these additional respite spaces.
Now, you mentioned something very important, that we're trying to prevent the strain on the healthcare system in general. And so this next question is related to that. Nora would like to know what can be done to protect people who need medical services like dialysis?
Yeah, so right now, I think the best thing, this is where we're kind of all in it together. We want to make sure that those dialysis centers can keep running and that they're not also overwhelmed, and that the folks that go there are not spreaders. So that does go back to these basics: coughing in your elbow, washing your hands, I mean, whenever you can, but after you cough or sneeze and after you basically touch any surface. So after this, I'll be sanitizing
Yes.
and washing and so forth. That is one thing about this virus that is a little bit different, in a sense that there are much more dangerous things, Ebola and anthrax, that are just airborne everywhere. This is not like that, meaning that washing your hands actually matters because it really is surface transmitted or within particles exchanged within a 6-foot radius. So the amazing thing is you can make a difference, literally. Like, you washing your hands is making a difference in this case. And that is one, I think it's like an encouraging point here, because you can be part of the solution by following these personal hygiene habits. And there are scenarios where that doesn't even help. In this scenario, it very much does.
Thank you. So we have several questions about city departments, and the first one is, why is the building permit department still open?
So this one, first, all our departments, city departments, are following the DOH protocols with respect to social distancing and repeated enhanced sanitizing, whether it's wiping down surfaces, workers again, sanitizing, washing their hands, etc. So we feel confident appropriate safety protocols are being handled by the employees. Why it's open is because we very much want folks, when they can, to continue to conduct business. We know this is going to be a disastrous hit to our economy. One way to minimize it is to keep issuing construction permits. We have found that in the construction industry, typically it's outside, and it's also often automatically spaced because of existing safety regulations. So in an interesting way, and I'm speaking in generalities, not specifically, the construction industry is one we want to keep going. We want to keep those folks working. And in fact, even at the city level, we're redoing the curbs on Central for the art project for safety, because there's not as many people on the streets. So it is a great time, if you can do it under appropriate safety and health guidelines, to actually do construction. And so that's why the permitting department's open.
So similar question, why is ABQ Ride still running our transit system?
So we're very much looking at this because ABQ Ride, we need to keep running if people need it for critical services. This is kids getting to meal programs, it's people getting to the grocery store, it's doctors and medical appointments. That is a large part of what our system is designed for. Now, we do understand that if the system is not being used for that, we'll shut it down. So we're watching this on a daily basis, and if it's being used for emergency transport, it's important that we step up and keep it open. Again, all those employees are following enhanced protocols with respect to cleanliness and sanitizing and so forth. And again, if we see that this doesn't seem to be part of our sort of emergency infrastructure, then we will close it down.
Thank you. Has anyone at the city, specifically transit, tested positive for coronavirus?
So the last data that we had is that no one has tested positive for coronavirus. We do know likely that's probably inevitable. So just so folks know, I think we employ 6,000 people, including police and fire, as well as transit. And so we expect that. It's unfortunate, but we know that's going to happen. And that's why we have protocols in place, the same ones that all healthcare workers and first responders are required to follow. So are all city employees that are essential. Now, I do want to mention we do have some reports of people who believe they've been exposed to someone who's had the virus. And so again, they're following the DOH protocol the same as anyone else would, which is self-quarantine at home.
Thank you. So this question comes from Sade in the South Valley. Is anyone making masks for first responders? You mentioned that there's a great need for PPEs and donations from businesses who may have them, but to your knowledge, is anyone making those masks?
So we are talking to different companies and providers to do that. The best thing we can do right now is put out, again, this call for donated masks and PPEs. And in terms of, I know I've seen all across the country and so forth that healthcare workers are being asked to kind of make their own and so forth. As a city, we're leaving that up to the individual if they want to do that. And we are looking at ways down the road if we need to kind of set up centers where we can all help make those. But as you can imagine, proper ones, it's a materials issue. So we're looking at this right now. This is one limitation to not having a bunch of major manufacturers in our town like some other larger cities do, where they can kind of switch what they're doing with production. So we're looking at it, but right now we're trying to first just collect everything that's out there already.
Now, you kind of touched on this on your media briefing that you did just a bit ago about child care providers. Do you have any plans to be closing those child care centers that the city operates?
So our child care providers right now are operating on a limited basis and by appointment only. And they're there really for, again, first responders and healthcare professionals or people who have to work. So we're trying to look at what does a safety net look like in Albuquerque. And part of that is, what do you do with kids who are too young to be home alone if they have one parent who has to work because they're a firefighter? That's who we want using those facilities. We also know for some individuals, again, they might not have a choice, even if they're just, they have to go to work because they're in an income situation that requires them to do that, and there's no one else who can take care of their kids. That's why those are open. They're literally propping up all the parents who have to work. So we want to continue to do that as long as we can as part of an effort in solidarity to support all of our folks who actually do have to work.
Great. So these next questions come both from retailers and business. And the first question is from Lex from Old Town and Brian in the Northeast Heights, and some fears around grocery stores being closed. Could grocery stores be closed?
So I don't believe any city, at least in America, has closed grocery stores. We know food is one of the emergency components that is one of the most important. So I think that's one thing. I don't think you need to worry about it. I think what would help is if people remember these stores are going to stay open. So you only need to get what you need sort of for the normal time period that you would. Our family usually shops once a week. And we are continuing to get what we need for the following week. So I think we can have confidence that our stores are going to stay open. And also we know that with the exception of some supplies, obviously we've all heard about toilet paper. When you go to the stores now, and I just did this a couple of days ago, there's lots of food there. They might not have exactly the kind of chicken soup that you want. I understand that. I know I was trying to buy Kleenex just because of allergies, and there was no like standard Kleenex, which I prefer, but all the lotion Kleenex that I actually don't like, that was still totally available. So, I mean, it's okay when there's still Kleenex on the shelves. It's just not the specific kind that we all like. So I think let's just remember to have, and this is one good thing, our water, our gas, our electricity, our food system, that should be okay. And so we can have some confidence in that.
So what's being done to keep people at stores from creating problems like fighting? You mentioned the shortage of certain supplies, but having others, but what's being done there?
For us, we want to just remind folks to try and, again, just literally be nice to each other and be patient with each other. We also know that this can happen, right? This is part of just human nature. So right now we're having just some enhanced presence at our grocery stores. We're asking our field police officers to do field briefings in the parking lots and assure people that they're safe while they're doing that. We're also asking our firefighters to do their shift changes and have their ladder trucks deployed at these different locations, just to remind folks to stay calm, and there's folks there to help if needed. I also know a lot of the larger stores, from Walmart's to Costco's, they also have their own private security, which in this case is very helpful too. And so by and large, Albuquerque, you've done a great job. We've all done a great job on this front, and so it's important that we keep doing that, but our first responders are ready as needed.
Great. So next question, what precautions are being taken in restaurants to prevent the spread utilizing takeout?
So I know the DOH is really taking the lead on this, again, the Department of Health, And there's a protocol that they've set in place that our restaurants are following. But it has to do with, I know, some tough choices about protecting staff and customers. And I know folks are having to cut their hours. Some of them close. The ones that are open are trying to use enhanced cleaning procedures, enhanced distancing, even preferring credit cards to cash and so forth. These are all good procedures to do. Americans' love of fast food is coming in handy. So actually, these types of restaurants are pretty well trained on this normally. So they're doing enhanced cleaning and enhanced distancing and enhanced scheduling and staffing. But the good news is, especially with even our environmental department who does health inspections and so forth, America in general is pretty good with respect to restaurant cleanliness and so forth. And so we're just stepping that up another notch.
Great. So Jerry from North Campus wants to know what's being done for small businesses and people losing their jobs. You mentioned the economic impact this may have, so that's a concern.
So right now, look, this is a major concern. And at the city level, we are very encouraged that the federal government and I know our delegation, our federal delegation has been pushing hard on these respective stimulus packages. This is the best thing for all of us because the federal government has the resources and the ability to actually really help. I know the state's also looking at different challenges that they can try and address. And again, the bigger the government, the more they can help on this front. So at the city, we are putting together our own, we do have a website up, which again, we can post that link, different ways that we're trying to help small businesses. There are some loans that are available that are interest-free. We're also trying to encourage everyone to do as much takeout as you can, to buy gift cards, to try and actually shop for groceries local. That's another thing that's very helpful. So we're working on a few different things, but right now I'm most encouraged actually by what the federal government is doing on this front. And we saw this with the economic stimulus back in the Great Recession in 2009. They're basically going to do an even bigger program, and I think that's going to make all the difference in the world. The last thing I would say is that file for unemployment. So if you're not working with your employees already on this, again, the majority of that cost burden is being supported. And I saw we have the highest numbers already that we've had in New Mexico in a long time. And I know our Secretary of Workforce Solutions is very talented and is there to help. And that is a safety net that is there for purposes like this. So folks should really take advantage of it.
Thank you, Mayor. You've answered so many questions today, and there's so many more to get to that we won't be able to have time to do so today, but we will carry them over for when we do this again. We'll continue to set these up, as you mentioned, via teletown hall or this format, but we really wanted to get it as many as we could, so thank you so much for doing that. And if you'd like to close with anything, feel free to do that.
Sure. Well, Albuquerque, I know, during this crisis, we all recognize that this is challenging for a lot of us. And we all know that there's a lot of things that we took for granted that now, we can't. Again, as I mentioned, from going to our favorite local restaurant to hanging out with our friends, all of this is a challenge. Even not being able to see the Gladiators or the United or the Isotopes, Little League, all of these things, it's really hard to actually put your head around all the things we're missing out on. But I know that we can get through this, and I do believe that next year all of those things are going to be back, if not sooner, and that's a good thing. So everyone is going to think about the year that was different. That's going to be this year. But I also know that we can get through this, and that together we're a strong and resilient city. We always have been. And in many ways, this is what Burke has always been good at, is getting through tough challenges. This is no different, and so we're going to be better coming out on it on the other side. So thank you for all being part of that one Albuquerque spirit. We're all in this together, and we're going to get through it and be better off for it in the long run. Thank you so much.